So far, my experience with digital dentistry, it's been an everyday occurrence, really. We started as early as first year, working in our sim lab, getting some experience and just evaluating our earliest work. And now that we've been transitioning more into clinic and actually seeing patients on a day-to-day basis, we've been able to use that and apply it to the way we treat patients, which has been tremendous in our learning capacity here at the school. So we started early off in our first year. We actually started scanning just our dentiforms, which was great because it was a great way to learn in a very low pressure setting. There wasn't a whole lot at stake. Moving into second year, we actually had the opportunity to then scan each other, our students. So it was a little bit less pressure than going and working with patients right away. And then, into third year, even late second year, we were able to start using the scanners on patients. For example, a lot of students in our class have been able to scan their crown preps, scan some of their restorative work. We have a lot of opportunities to now place implants into our third year, and using guided technology with the scanners and CBCTs, we've actually been able to apply and kind of merge that technology together to do some very cool implant surgery, which is, we're very fortunate to be able to do that here at UK. I do have quite a few friends at other programs, and while I think a lot of schools in the country, they're actually starting to use digital technology, I think at least our exposure to it so early on at UK it's far and above any other program. Especially when it comes to patient care, we're actually getting to apply, like I said, with things such as implant dentistry. As early as once we finish our third year case in the school, we're actually able to do digital dentures, which is something that's really on the cutting edge of dentistry, and to work with that technology so early on and to really learn skills that typically, as a dentist, you learn down the road in CE courses. It's irreplaceable knowledge, and you get to do it while you're still learning to earn your DMD. It's terrific. Fortunate to be going to an office after school where we'll have some digital technology, but what's great is I'll already have a leg up in knowing a lot of the different systems out there and how to communicate with dental labs as far as sending the images and the material that we acquire using digital technology. But what's great, the school also does teach you a lot about how to do things the conventional way. And I think having a good understanding of conventional impression taking is very important, to have a good understanding of how you can use digital technology to your advantage. But it's something that patients really appreciate. They love seeing the newest and best technology. As students, it's a blessing to be able to use it. We're getting to use things that typically you wouldn't learn until you're out in a residency program. And to have that experience right off the bat, it's very, very useful. You can market yourself in a lot of ways as a student, which is very important post-grad. As of right now, I'm considering, I'm looking into all my options. I'm still a third year, but I'll be honest, after this 4 years at UK, I definitely think that they prepared me for whatever lies ahead of me. If I wanted to go straight out into practice, I'm confident that I would have the skills to do that. But at the same time, if I wanted to go and actually, build upon that education in a residency, I think I would definitely have a leg up upon other students, kind of that, not really that we're competing against, but it's a great way to advance and build off what I've already had established here at UK. I'm doing a case right now with restoring 4 implants. We're actually going to do that digitally, which is very interesting. And then just because of the complexity of the case and where things are, we actually have to do some conventional crowns around those implant crowns. But getting to do all of it digitally is something that it's going to be, I think, a life-changing experience for the patient, but also for myself. It's something I'll carry with me for a long time. I've had this patient already for quite some time now. We've worked her up to this point where we're finally ready to finish the process, and I can tell how much it means to her, but it means a lot to me that I've been trusted with the opportunity to complete this process for her. So it's very, very special to me. My favorite thing about the school, I'm an out-of-state student, but I was so drawn to the family environment here at UK. There's only 65 students per class. You get a great opportunity to become very close with your professors and your fellow students. And getting to use all this technology is one thing, but to have it in a one-on-one environment, because by nature it is a little bit more complicated to get familiar with it. So being in that smaller class size setting, I think it's allowed me to really take the most advantage out of these learning opportunities. And I've become very confident in my skills in clinic and seeing patients, and I think UK is 100% responsible for giving me that confidence.